New parents are subjected to all kinds of contradictory advice about infant nutrition. In life, as in other things, where you start can determine where you finish. Infancy, the first year of life, is a prime time for growth and changes throughout the body. What we eat as infants strongly affects our long-term body weight, health, metabolic programming, immune system, and overall aging. The first 6 months. Breast is best for both mom and baby. Babies can be exclusively breastfed for their first 6 months of life. Breast milk is the optimal nutrient mix for infants. It's full of good stuff like antibodies, antimicrobial factors, enzymes, and anti-inflammatory factors along with fatty acids, which promote optimal brain development. We have talked about the benefits of breastfeeding in previous videos on our channel. Please find them, they will help you a lot. Supplementation while breastfeeding. Breast milk will provide all of the nutrients the infant needs for the first 6 months of life. However, some babies may need a bit of supplementation at times. Vitamin D. Because modern life, especially in northern latitudes, leaves so many of us with low vitamin D levels, many mothers are deficient in vitamin D while pregnant and breastfeeding. Additionally, preemies are often low in vitamin D. This means that infants may need a vitamin D supplement. The American Academy of Pediatrics (AAP) recommends a daily vitamin D supplement of 400 IU for all breastfed infants, starting immediately after birth. Note, once formula-fed infants are up to about 30 ounces of formula per day, which is usually around 2 months, you can discontinue vitamin D supplementation. However, it is recommended that breastfed infants continue vitamin D supplementation for at least 1 year. In the end, some babies can get enough vitamin D from breast milk. But the mom needs to have solid vitamin D levels for this to happen, which most don't. If you're pregnant or a new mom, check with your doctor and pharmacist about testing your vitamin D levels, and the best and safest options for your infant. Vitamin B12. Breastfeeding mothers who eat an exclusively plant-based, vegan diet should supplement with vitamin B12. Iron. A fetus will store iron from the mother's blood while in the womb. Premature babies need extra iron because they do not build up enough stores. Breast milk doesn't have much iron, but it is well absorbed. Iron stores will last until about 6 months of age, thus no iron supplement should be required during this time. Formula-fed infants will likely get enough iron. Probiotics. Babies are born with a sterile environment inside. As they pass through the birth canal, the mother's bacteria colonize infants' mucous membranes and gastrointestinal tract. This is normal and desirable, just how nature intended. However, in an environment of modern cleanliness, or perhaps after a C-section, this bacterial colonization doesn't happen as easily or well. This can lead to later gastrointestinal, respiratory, and/or ear-nose-throat type infections in babies, as well as a lower immune system. In this case, parents can supplement with an infant probiotic formulation. Talk to your pharmacist to find out what's best. Fluids and hydration. The amount of fluid in breast milk or formula will usually be enough, so normally you shouldn't need to supplement with water. However, infants easily and quickly become dehydrated under certain conditions, such as if the infant has a fever or is vomiting a lot, or if the climate is very hot. Rehydration is also crucial if infants have diarrhea. In this case, add a little sugar and salt to the water to make a simple electrolyte solution. Use urine color as a guide. Dark yellow urine will signify dehydration. Clear urine signifies potential overhydration. You want to see something somewhere in the middle. Baby will undoubtedly oblige with a urine sample, probably at the most socially inconvenient time. Following is a video for 6 to 12-month-old babies. If you like the video, please like it and subscribe to my channel in order to get it. Thank you.